So if you set the stage and you say, look, we're sending this to the laboratory or we're fabricating it in our in-house, and the next time you come in, we're going to go for a try and we want to make sure it looks good, feels good, functions well, et cetera. There's a lot of parameters. We take our work extraordinarily seriously, and there's a small percentage of cases where it just doesn't meet my standards, and therefore we need to modify ever so slightly in one of those various factors. And I want to make sure that you get the best restoration possible. I mean, think about psychologically what you're setting up. You're setting up an expectation of excellence. Then, therefore, talk about reduction of stress. It's like, look, you know what? I'm just not happy with this. This doesn't meet my standards. This is what we need to do. And you move forward, and the patient's like, you're such a great dentist.
That was one thing that I didn't realize until I was teaching this. I was teaching it as a way of preparing the patient so that the patient wasn't stressed and pissed off if something didn't work, which impacted me. My stress reduction was more dependent on reducing the stress of the patient. However, once I started teaching this in Lightside Academy, I got a lot of feedback of people saying, me setting the expectation for the patient that I don't have to deliver it that day reduced the stress on me when I walked into the chair.
100%.
And I didn't even realize how important that was until it was being used at scale.